So my name's Ted Jones. I'm a clinical psychologist at Pain Consultants of East Tennessee. As a pain psychologist, pain physicians came to me and said, help my patients. And so I scoured the literature, tried to figure out what would be good for pain patients. And there are a lot of different thoughts, and after some time I sort of coalesced them into 5 general skills that pain patients need. And so there's no way to really validate whether these are the skills and there's another skill or that kind of thing. But so it's a concept more than an empirical test. But as you read the literature about pain psychology, everybody seems to talk about these 5 basic skills. So we've packaged them and give them names and talk about with our patients that there's 5 skills. And it's a good way to help patients and providers understand what patients need and what they're good at and maybe what they need work with. And so it helps with treatment planning if you can kind of conceptualize that there are 5 skills and how are they doing on each one of those. And we've talked to a lot of patients that seem to be doing well in their pain journey, and they describe these 5 skills. So the 5 pain skills, one is understanding. Anytime somebody has a medical diagnosis or problem, the first thing we all do, we used to go to the library, now we go to the WebMD and say, what is that? What is that thing, the stenosis or spondylolisthesis? So there's understanding about what the condition is and what is it fatal and what's it going to do, and is it going to get worse? And then there's also understanding how it's treated. That's the next thing you want to find out is how do people usually treat that? Shots, pills, is it going to get better? Can it get better? So there's general understanding, and that's where pain education comes in. We have a American Society of Pain Educators, and that's a big focus of them is helping patients understand what they've got and what the issues are that they're going to be facing. The next one is thinking or acceptance. Well, patients need to understand how to think about their pain and that has a big impact on their pain, and to not struggle with it quite so much. That makes the pain better, and it also makes their mood better. And that's a very tough one, but there's that general cognitive behavioral therapy is more the classic, acceptance therapy or some of the classic treatments in that vein. But there's how they think about pain is another one. Calming. Stress makes pain worse, and so you need to have a relaxation, calming skill to deal with stress and also know how to get your body relaxed. That helps with pain. Then there's a skill of balancing, which is a general topic about having habits that work for you, having sleep patterns that are appropriate and you're not up all night and sleeping all day. Activity pacing is a very big one with that, not overdoing it and crashing, but also having appropriate exercise, not just sitting on the recliner all the time waiting for the pain to be better. So having moderate exercise. Assertiveness is a part of that, being able to say no and set priorities. So there's getting a balanced lifestyle, that you're spending your time where you want to be spending it and not doing things that you don't want to be doing and things that are helpful for you. And then finally, coping. What do I do when it hurts? Which is surprisingly left out of many textbooks. People get that at community gatherings and churches. Oh yeah, do this liniment and put this on it. And so we go over what are things to do that help with pain. It depends on what kind of pain you have as to which thing would be good. Ice is good for some things and heat is good for other things. So knowing a little bit about pain and how pain works, that's the other part about pain education is how does chronic pain work? There's more to it than just tissue damage. And so knowing where patients can intervene with that. And then that leads to coping, which is what do I do when it hurts? Distraction is a big coping technique, work with all kinds of pain. So all pain patients need to have ways to cope with pain and also include distraction. So they're not focusing on their pain, and it gives good pain relief. So those are the 5 general skills: understanding, thinking, calming, balancing, and coping. And then within that, there's a lot of sub-skills and different things we can teach. Distraction is probably the most effective analgesic there is on burn units. The best analgesic is some opiate medicine and distraction. And they've been using virtual reality for 20 years on many burn units. Works very well, especially when you have the virtual reality headset kind of thing. It's very immersive. You see a lot of it with adult coloring books where people are doing those kind of things and reading and that kind of thing. But having your focus on something cuts down the pain sensation that's traveling through the spinal cord, and so you don't feel it as much. So having some sort of distraction, and like I say, we're working with trying to get machines. So virtual reality headset is really good. We've done some experiments with it at our office, and it cuts pain twice as well as morphine. It doesn't last very long, it lasts somewhat after the session, but not a real long time. So we need to work on how to get that to consumers. But that's a real important skill to have. So with these coping skills, getting physicians to understand and be knowledgeable about those. Traditional medicine, there's two things traditional healthcare does for pain. They do an interventional approach, shots, surgeries, trigger point injections, whatever, and prescribed medicines, pharmaceuticals, opiates, non-opiates, NSAIDs, muscle relaxers, all that kind of stuff. And we tend to get really focused on those two things. That's how you help pain, shots and pills. Having the patient understand that they have a role and that they have some skills, and they're very important skills, I think has been a real challenge. It takes some time to get patients to understand those skills, and also it takes time to get physicians to understand that there are those whole set of skills, and to teach them and figure out, does the physician teach them a little bit each session? Do you have a group session? Do you have individual sessions? There are very few pain psychologists. There's not enough to go around, so you can't just refer to a psychologist and say, oh yeah, they'll take care of it. So getting the general medical community aware that they call it the three-legged stool of there's interventions, pharmaceutical, and also self-care. And so this is what self-care is, those 5 skills. And so getting that incorporated into all pain practices is a real challenge.